I understand how that works.
So yours...
And what does it mean and what is it? Because I've been trying to educate myself and other people about that.
Wait, I see your vitamin D was low from a couple times ago. Are you on it?
I just got the prescription on Friday because I asked my my primary care physician, and that's probably another reason why I ache so much.
Okay.
And I said, I have to take a prescription strength. Okay. So I have to pick it up from Ecker today, and I'll start taking it.
Okay, perfect. So tumor markers are not very important in patients with early stage disease. It's more important with patients who have disease everywhere, metastatic disease. So for you, we check it, but not really worrying about it too much. They can go up a little bit on treatment because it's just a protein that marks inflammation in the body, specific for breast cancer. There's some that are specific for colon cancer, some that are specific for pancreas cancer.
Okay, because I use that for my thyroid cancer. When I get the tumor markers done, they look at that.
That's like your TSH, though.
Yeah,
that's
TSH.
Not a tumor marker. That's a hormone.
Right, but they also do like the T3. They do a whole bunch of ones together.
Those are not tumor markers. Those are all hormones. TSH, T3, T4, all thyroxine. These are a little bit different. They're specific to cancer.
Okay.
But like I said, not very important for you because you're not metastatic. Okay.
Praise God.
Exactly.
God is just so awesome.
Did you get blood work today or no?
I did. Just got blood work.
Okay.
So I was a little bit discouraged because I went through, as you know, so much with the port. And I was told that you can access the blood through that way for labs.
Right.
But then they didn't do that today.
So no. So that's a little bit of a misnomer. So you have to get blood drawn through your arm because if your hemoglobin, red blood cell, or your white blood cells, red blood cells, or platelets are too low for treatment, we don't want to access the port. It would be a site of infection.
Oh, okay.
If those white blood cells were too low, we don't want to stick a needle in there because you don't want anything going into your body.
Okay.
And it has a direct line to one of your veins, your major veins.
Okay.
That's why I do everything through here. As long as everything's fine, then they access the port.
Okay.
So only, unfortunately, chemo gets drawn through there.
So I did bring up to Dr. Barry that I was a little bit concerned about reading the literature for the Neulasta because I saw that one of the adverse events is about your enlarged spleen, and I have that problem anyway with my.
Never ever seen it.
Really?
Never,
okay.
Ever.
Okay.
It's in there for sure. I know.
And I work in pharmacovigilance before, so
you're like
I'm like,
yeah. Never seen it. Okay. Very, very rare. The things that definitely will likely happen: bone pains.
Right, and I saw the neutropenia and all that stuff like that.
So let's see. So your treatment today. So that means your shot will be. Can you come in tomorrow?
Yes, I'm gonna get the
Tuesday or Wednesday.
I'm gonna do Tuesday.
Okay. Let me just change this.
So today I get the AC, and I guess the first one is manually pushed in.
The nurses will tell you about. That. Yeah. They will set you up.
So are the levels from last time? Are they? It says lymph high.
So
like what?
We don't. So your CBC, white blood cells, red blood cells, the WBC, the hemoglobin, and the platelets are the things we care about the most. In between there, things are going to be high and low.
What are your cutoffs? So the white blood cell, what would stop you from getting treatment?
Stop you, we look at your ANC, which is your granulocyte number. Less than 1, you wouldn't get treatment.
Okay.
It's okay if you're anything above that because we're going to give you that Neulasta shot, which is going to make this number go super, super high.
Okay.
But if you're less than that or not feeling well, feverish, things like that.
That's that grand number.
That's granulocyte.
Okay.
Hemoglobin is not going to really stop you. Platelets can stop you from getting treatment, and that's not a hard and fast
number. And that's under what number usually?
It's not a hard and fast number.
Okay.
You have several weeks. Some patients get treated every single week, in which case we worry about their platelets more. You have a break, so your bone marrow is going to have time to recover. If you're less than 70, usually, but you're perfectly fine. Your hemoglobin is a little bit on the low side.
But I started that way, but I started taking a B complex vitamin. Okay. So that way I can help with my red blood cell count. I was anemic way before this.
That's okay. That's all right. No, it's good to take. And we'll monitor, obviously, every time you're here.
So you really are more concerned with the white blood cell and the platelets.
Biggest concern.
Right.
Yes.
Now, my white blood cells are a little bit elevated because I take steroids, and that gives you that false...
But you're fine. You're normal.
Okay.
To be honest, you're normal.
Good. I need to get a little bit more rest. I'm a little bit run down today. I know rest is important not to get sick, so... Awesome.
All right. Let me just see your labs from today.
Yeah, I'm a little bit achy today, and I didn't take my steroids. I talked to Dr. Barry, and he said, since I'm going to get the Decadron, I'll just get it through IV. Yeah.
Hey, do you have Penelope's labs? Oh, okay, thanks. Okay, let's just listen to your heart.
Okay.
All right, where you are. All right, deep breath. Good. Good.
Just so you know, I'm asthmatic. I never smoke. That's why
I don't even hear any wheezes. Just breathe normal for me and listen to your heart. Perfect. Any swelling in your ankles or anything to start? No.
No.
Nothing. Good. She's just rerunning your blood. It didn't drop in the first time.
Okay.
Feeling okay?
I am. Just a little run down. I should have got a little bit more rest, but other than that, I'm ready to go.
Okay.
And I realized I could just sleep and
you can sleep. You can watch TV.
Rest.
You can do whatever you want.
The change in weather, it got kind of cold, so my throat feels kind of sore.
It was a surprise this morning, wasn't it?
Yeah.
I had the windows open. I was like,
yeah, and I woke up a little
this?
bit of sore throat, so I'm like...
Yeah. Humidifiers are good in the winter. We tell a lot of our patients chemotherapy can cause dry skin for anybody.
Mm-hmm.
So if you find that that's, you know, even if you're more than normal, the nose is dry, the throat is dry, all that, I would invest in a humidifier.
Okay.
All right, let's... So the nurses will give you all your appointments from here on out. Not all of them, but I mean the nurses will make them all for you.
Okay, yes. I'm scheduled every other Monday, and then I come in Tuesday for the Neulasta shot.
Exactly.
For the first 4 rounds.
Yep.
And then I do every week.
Correct.
For 12 weeks.
Correct. Yep.
For the last drug, which is Taxol.
Exactly, you got it.
So, God willing, I'll be done in February.
Very exciting.
So, this type of drug that I'm getting, because I'm coming every other week, is that because it's a stronger chemotherapy?
So every chemo has its own regimen.
Oh, okay.
It's not that it's more strong, less strong.
Okay, that's
just
the protocol for that AC drug.
Exactly.
Okay.
Can't be given on a weekly basis.
Oh, okay.
Yep. The Taxol can be.
Yes.
That's just the difference.
That's the only thing I was wondering, because I know, and also I guess it's the therapy related to the disease where it's at, because some people come more than one time a week, and I'm like, you know, and people were surprised. They're like, I'm like, no, I go once every other week. They're like,
yeah. So that's normal for
non-metastasized.
Well, so not necessarily location, but just the hormone status of your.
Since I'm HER negative.
You're all negative, so you don't get the HER2 positive patients come in once every 3 weeks versus every other week.
But then they also have the medication they take for years, also.
Correct.
So there's a pros and cons with it, where
you got it.
HER2, so it attacks it, it binds to it, knows where to find it. Mine has to go and get everything, but they also have to take medication for years.
You're right. So your counts are fine today, just so you know. I just got them in. They're very similar to what they were, as they should be, because you haven't gotten anything yet to make them not fine.
Yay. Hercules.
All right. Excellent. Come with me. Let me show you where you can take that. That's for you.
Thank you.
Very nice to meet you. Are you going to be coming to this office or Morristown?
The Morristown office. Are you in the Morristown office at all?
I am here. I'm Denville on Mondays. I'm Morristown Thursdays. So
okay.
Debbie Smith is one of the nurse practitioners. You'll see her on
okay. Am I going back already for treatment?
Right.
Oh, my family was with me. I didn't bring them. Okay.
So just take a seat. We're a little bit busy today because we have a lot of Morristown patients. We try and limit it to one person.
Right, because you have that.
We're training for new EMR system.
Yeah.
So we're trying to limit it to one person, family member. Yeah. So just because it gets very busy in here, but you can sit in any one of the recliners, and the nurses will come over to you. Okay.
This chair looks kind of big.